The power of your voice, revolutionizing healthcare through self-advocacy. Welcome to the BlackCEO Podcast. Today, we're embarking on a journey that will challenge everything you thought you knew about healthcare, patient rights, and the immense power of your own voice. We're diving deep into a story of resilience, advocacy, and the transformative power of taking control of your health. I recently had the incredible privilege of interviewing Kristie Fields, a two-time cancer survivor and the founder of a groundbreaking nonprofit dedicated to empowering families affected by cancer. Kristie isn't just a survivor. She's a warrior, a visionary, and a beacon of hope for countless individuals navigating the complex world of healthcare. Her journey isn't just inspiring. It's a wake-up call that has the potential to revolutionize how we approach our health and well-being. Kristie's story is one of courage in the face of adversity, of finding strength when the world seems intent on knocking you down. But more than that, it's a story about the untapped potential that lies within each of us. The power to advocate for ourselves, to challenge the status quo, and to take an active role in our own healthcare journey. Now, I know what some of you might be thinking. Another talk about health? Let me guess. Eat your veggies, exercise more, and don't forget to floss. Well, I promise you this isn't that kind of talk. This is about reclaiming your power in a world that often makes you feel powerless. It's about standing up and declaring, I may not have a medical degree, but I know my body better than anyone else. Let's face it, how many times have you left the doctor's office feeling confused, unheard, or dismissed? How often have you swallowed your questions because you felt intimidated or rushed? We've all been there. We've all felt that twinge of doubt, that nagging feeling that maybe we should speak up, but then we don't. We trust the experts, even when our gut tells us otherwise. But here's the thing. You are the expert on you. You live in your body every day. You know when something feels off, even if you can't explain it in medical terms. And that knowledge, that intuition, is incredibly powerful. It's a tool that, when combined with medical expertise, can lead to better outcomes, faster diagnoses, and more personalized care. Kristie's journey began like many others, with a diagnosis that turned her world upside down. But what sets her apart is what she did next. Instead of simply accepting what she was told, she became her own advocate. She asked questions, demanded answers, and refused to be silenced. And in doing so, she not only saved her own life, but has gone on to empower countless others to do the same. Let me share with you a moment from Kristie's journey that truly illustrates the power of self-advocacy. During her first battle with cancer, Kristie was presented with a treatment plan that didn't sit right with her. Something in her gut told her there had to be other options. Now, many of us might have just nodded along, trusting that the doctors know best. But not Kristie. She spent hours researching, reaching out to other patients, and seeking second opinions. It wasn't easy. There were times when she felt like she was being difficult, like she was causing trouble by asking questions. But she pushed through that discomfort because she knew that her life was on the line. And you know what? Her persistence paid off. Kristie discovered treatment options that her original doctors hadn't even mentioned, options that ended up being crucial to her recovery. This wasn't just a victory for Kristie. It was a powerful reminder that we all have the right and the responsibility to be active participants in our healthcare decisions. Now, I can almost hear some of you thinking, that's great for her, but I'm not facing a life-threatening illness. How does this apply to me? And that's a fair question. But here's the thing. You don't have to wait for a crisis to start advocating for your health. In fact, it's better if you don't. Think about your last routine checkup. Did you mention that weird pain you've been having? Did you ask about that mole that's been bothering you? Or did you just nod along, answer the standard questions, and get out of there as quickly as possible? If you're like most people, it was probably the latter. But what if you approached every doctor's visit like Kristie approached her cancer treatment? What if you came prepared with questions, with observations about your body, with concerns you want addressed? What if you saw each interaction with the healthcare provider as an opportunity to learn more about your body and to take control of your health? This isn't about being confrontational or difficult. It's about being proactive. It's about recognizing that your health is exactly that, yours. And you have not just the right, but the responsibility to be an active participant in it. Let me share another story that highlights the importance of this approach. During our interview, Kristie told me about a woman she met through
her nonprofit, let's call her Sarah. Sarah had been experiencing unusual symptoms for months, but had been brushed off by her doctor, who attributed her complaints to stress and anxiety. Inspired by Kristie's advocacy work, Sarah decided to push back. She kept a detailed log of her symptoms, did her own research, and insisted on further testing. Lo and behold, it turned out she had a rare autoimmune disorder that had been missed in initial examinations. By advocating for herself, Sarah got the diagnosis and treatment she needed months earlier than she would have otherwise. This story isn't unique. Time and time again, Kristie has seen how self advocacy can lead to better health outcomes. But it's not just about individual health, it's about changing the entire culture of healthcare. When patients like Kristie and Sarah speak up, ask questions, and engage actively in their care, it doesn't just benefit them. It encourages healthcare providers to provide more detailed explanations, to consider alternative options, and to treat patients more like partners in their care. It's a ripple effect that has the potential to transform our entire healthcare system. Now, I know what some of you are thinking, but I'm not a doctor. I don't know what questions to ask. And that's okay. You don't need a medical degree to advocate for yourself. You just need to start paying attention. Notice how your body feels. Keep track of changes. And most importantly, don't be afraid to speak up when something doesn't feel right. Kristie's story teaches us that sometimes the most important question you can ask is simply, why? Why this treatment? Why not that one? Why do you think this is happening? These simple questions can open up dialogues, reveal new information, and sometimes even lead to better treatment options. But self advocacy isn't just about asking questions, it's also about doing your homework. Kristie spent hours researching her condition, learning about different treatment options, and connecting with other patients. She became, in her own words, a student of her disease. And that knowledge gave her the confidence to have meaningful conversations with her doctors and to make informed decisions about her care. Now, I'm not suggesting you need to become a medical expert, but in this age of information, we have unprecedented access to health resources. Use them. Read reputable medical websites, join patient forums, connect with support groups. The more you know, the better equipped you'll be to participate in your own healthcare decisions. But perhaps the most powerful lesson from Kristie's journey is the importance of trusting your instincts. There were times when she just felt that something wasn't right, even when she couldn't explain why, and those instincts, more often than not, turned out to be correct. Your body has a way of communicating with you. Learn to listen to it. This doesn't mean ignoring medical advice or thinking you know better than trained professionals. It means combining your innate knowledge of your body with their medical expertise to create the best possible outcomes. Let me share one more story that really drives this point home. Kristie told me about a man in her support group. Let's call him Mike. Mike had been in remission from cancer for several years when he started experiencing some vague symptoms. Nothing major, just a bit more fatigue than usual, some minor aches and pains. His doctor wasn't concerned, chalking it up to normal aging. But something didn't feel right to Mike. He pushed for more tests, even when his doctor seemed reluctant. And guess what? It turned out his cancer had returned, but it was caught early enough that treatment was highly effective. Mike's story is a powerful reminder that you know your body best. You live in it every day. You know what's normal for you and what isn't. And that knowledge is invaluable. Now, let's talk about the ripple effect of self advocacy. When Kristie started speaking up for herself, she noticed something interesting. Not only did her own care improve, but she saw changes in how her healthcare providers interacted with other patients. Her questions and her engagement encouraged her doctors to provide more detailed explanations, to consider alternative options, and to treat patients more like partners in their care. This is the power of advocacy. When we speak up, we're not just helping ourselves, we're paving the way for others. We're changing the culture of healthcare, one conversation at a time. But self advocacy isn't just for times of illness, it's a lifelong practice that can lead to better health outcomes, more satisfying healthcare experiences, and a greater sense of control over your well being. It's about being proactive rather than reactive. It's about taking charge of your health before issues arise rather than scrambling to catch up when they do. So, how can you start advocating for your health today? Here are a few simple steps. First, start paying attention. Really tune into your body. Notice how you feel when you're at your best so you can recognize when something's off. Second, keep records. Jot down any symptoms you experience, when they occur, and what might have triggered them. This information can be invaluable when talking to your doctor. Third, prepare for your appointments. Write down your questions and concerns beforehand. Don't trust your memory in the moment. It's easy to get flustered and forget important points. Fourth, bring a friend or family member to important appointments if you can. They can provide support, take notes, and sometimes think of questions you might not. Fifth, don't be afraid to seek second opinions. It's your right as a patient, and it can provide valuable perspectives on your health. And finally, remember that you are the CEO of your own health. Your healthcare providers are your highly skilled employees, but ultimately, you're the one in charge. Now, I know this might feel overwhelming. The idea of challenging medical professionals or speaking up when you're feeling vulnerable can be daunting. But remember Kristie's words, your voice is your power. Use it. Start small if you need to. Maybe at your next checkup, you ask one question you've been too afraid to ask before. Maybe you mention that nagging symptom you've been ignoring. Each time you speak up, it gets a little easier. And each time you advocate for yourself, you're not just improving your own care, you're contributing to a healthcare culture that values patient input and collaboration. Kristie's journey from cancer patient to health advocate is a powerful reminder of the strength we all have within us. It's a call to action for all of us to take control of our health, to use our voices, and to never underestimate the power of self-advocacy. But let's take this a step further. Imagine a world where every patient felt empowered to speak up, to ask questions, to be an active participant in their healthcare. Imagine a healthcare system where doctors and patients work together as true partners, combining medical expertise with personal insight. Imagine the breakthroughs we could achieve, the lives we could save, the suffering we could prevent. This isn't just a dream, it's a possibility. And it starts with each one of us. It starts with you. So here's my challenge to you. At your next healthcare interaction, whether it's a routine checkup or a more serious appointment, I want you to speak up. Ask that question you've been holding back. Share that concern you've been minimizing. Be the CEO of your health. But don't stop there. Share what you've learned today with others. Encourage your friends and family to advocate for themselves. Be a support for those who might be struggling to find their voice. Because when we all start speaking up, that's when real change happens. Remember, your health is your most valuable asset. Guard it fiercely, advocate for it passionately, and never, ever be afraid to use your voice. Because as Kristie Fields has shown us, that voice might just save your life. And who knows, it might just change the world. Thank you for joining me on this journey today. Now, go out there and make your voice heard. The future of healthcare, your future, depends on it.